Being pregnant is complicated enough when you have a home, regular doctor visits, and a support system. Now imagine being pregnant while living on the streets, where a simple urinary tract infection could cost you your baby, and you can't afford the $4 antibiotics that would cure it. Maria, a 26-year-old woman I met at a shelter, was 7 months pregnant and terrified. Every twinge, every cramp, every unusual feeling makes me panic, she told me, unconsciously rubbing her swollen belly. Is it normal pregnancy stuff, or is it an infection that's going to kill my baby? I have no idea, and I can't afford to find out until it's maybe too late. She wasn't being overdramatic. Research shows that homeless pregnant women are 3 times more likely to experience pregnancy complications, with infections being the leading preventable cause of premature birth and infant mortality in this population. That's not just statistics, that's hundreds of babies who don't survive because their mothers couldn't access basic healthcare. I spent 8 months following pregnant homeless women, documenting their struggles, their survival strategies, and the incredible lengths they go to protect their unborn children from infections that could end everything. What I discovered was a world of constant vigilance, creative problem solving, and heartbreaking choices. These women become experts in prenatal self-care out of pure necessity, monitoring their bodies with an intensity that would exhaust anyone, making decisions that no pregnant person should have to make alone. Trust me, after seeing what these mothers endure to give their babies a fighting chance, I'll never take prenatal care for granted again. The determination isn't just impressive, it's proof that maternal instinct can overcome almost any obstacle, even a healthcare system that's completely failed you. Let's start with the most common and dangerous infection pregnant homeless women face, something that seems minor but can destroy a pregnancy in days if left untreated. Because urinary tract infections are every pregnant homeless woman's nightmare, and preventing them requires resources and hygiene practices that are incredibly difficult to maintain on the streets. UTIs happen when bacteria enter the urinary tract, and pregnancy makes women more susceptible to them because hormonal changes relax the urinary tract muscles. For homeless women, the risk factors multiply exponentially. Limited access to toilets means holding urine for dangerous lengths of time. Inability to clean properly after using the bathroom creates bacterial breeding grounds. Dehydration, common when clean water is scarce, concentrates urine and promotes infection. It's like a perfect storm of infection risk, explained Rachel, a former nurse now pregnant and homeless. Everything about street life makes UTI more likely, and everything about being pregnant makes UTI more dangerous. The symptoms of a UTI, burning during urination, frequent urge to pee, cloudy or bloody urine, pelvic pain, are things pregnant homeless women learn to monitor obsessively. I check my urine color every single time I go, Maria shared. Clear or pale yellow is good. Dark yellow means I need more water. Cloudy or pinkish means potential infection and immediate panic. I've become a urine expert, which is not a skill I ever wanted to develop. Prevention becomes a full-time job. Drinking enough water is crucial, but as we've discussed, accessing clean water consistently is already a challenge. When you're pregnant, you need even more water, about 10 cups per day. I spend half my day hunting for water to drink, one woman explained. Fill up every bottle I have whenever I find a good source. Urinating frequently is essential, but finding bathrooms regularly is the eternal struggle. Holding your bladder gives bacteria time to multiply. You're supposed to pee every 2 to 3 hours when pregnant, but when bathrooms are scarce, that's impossible. I've peed behind so many dumpsters and buildings during this pregnancy, Jennifer admitted. Not ideal, not sanitary, but better than holding it for hours and risking infection. You do what you have to do. Dignity takes a backseat to survival. Wiping front to back after using the bathroom prevents fecal bacteria from entering the urinary tract, but proper cleaning requires toilet paper, which isn't always available. When public bathrooms are out of toilet paper, I use napkins, paper towels, whatever I can find, Rachel said. I've learned to grab extra napkins from every fast food place I visit, stockpile them for bathroom emergencies. Running out of something to wipe with when you're pregnant and trying to prevent infection is genuinely scary. Changing underwear daily is recommended, but when you only own 2 or 3 pairs and can't wash them regularly, that's not feasible. I wash my underwear in sinks whenever I can, trying to get them clean and dry before wearing them again, one woman shared. But sometimes they're still damp when I put them back on, which creates more infection risk. This impossible cycle where trying to stay clean is hampered by not having the resources to actually be clean. Cranberry juice is known to help prevent UTIs, and some women prioritize spending money on it. A bottle of cranberry juice costs about $3, which is expensive when you're budgeting $5 per day for everything, Maria explained. But I buy it when I can because preventing a UTI is cheaper and safer than treating one. Those little cranberry juice boxes from the dollar store have become my pregnancy supplement. When UTIs do develop, recognizing them early is critical. The longer an untreated UTI persists, the more likely it spreads to the kidneys, causing a kidney infection that can trigger premature labor or sepsis. I had a UTI that progressed to a kidney infection, one woman recalled, tears forming. Ended up in the 5 months pregnant with a 103-degree fever. They saved my baby, barely, but told me if I'd waited another day or 2, we probably both would have died. Now I'm paranoid about every twinge. Treatment requires antibiotics, which means accessing healthcare. Free clinics are the first option for women who know about them. The prenatal clinic at the community health center has been my lifeline, Rachel said. They give me free prenatal care and treat infections immediately. Without them, I don't know what I'd do, probably lose my baby, honestly. They also give me prenatal vitamins and connect me with other resources. Emergency rooms treat serious infections, but as we've discussed, accessing a care comes with its own challenges. When my UTI got bad enough that I was peeing blood, I went to the Jennifer shared. They treated me, gave me a 3-day course of antibiotics, and told me to follow up. But 3 days isn't enough to fully treat a UTI. I needed 7 to 10 days of antibiotics, but couldn't afford to fill the full prescription. The infection came back worse 2 weeks later. Some women have learned to recognize UTI symptoms so well that they ask for antibiotics proactively at clinic visits. I tell my clinic doctor at every appointment, even when I don't have symptoms, that I'm worried about UTIs, one woman explained. Sometimes they'll prescribe preventive antibiotics or give me a prescription to fill if symptoms develop. Having that prescription in my pocket gives me peace of mind, even if I can't afford to fill it immediately, but UTIs are just one infection risk. Pregnancy affects the immune system, making women more vulnerable to all sorts of infections that could normally be fought off easily. Because your immune system is suppressed during pregnancy, so your body doesn't reject the baby, which means infections that would be minor nuisances when not pregnant become serious threats. Respiratory infections like colds, flu, and pneumonia are more dangerous during pregnancy. They can cause fever, which is dangerous for the fetus, and severe respiratory infections can reduce oxygen to the baby. I got a bad chest cold at 4 months pregnant, Maria recalled. No money for medicine, just had to tough it out. Spent 2 weeks terrified that my constant coughing was hurting the baby or that my fever was cooking his brain. The stress alone probably wasn't great for him. Preventing respiratory infections requires staying away from sick people, which is nearly impossible in shelters where people are packed together. Shelters are germ factories, one woman said bluntly. Everyone's coughing, sneezing, sharing close spaces. I've started sleeping outside more often during this pregnancy, even in winter, because at least outside I'm not breathing everyone else's germs. Cold but healthy beats warm and sick. Hand washing is crucial for preventing respiratory infections, but again, requires access to soap and water. I wash my hands obsessively whenever I can, Rachel explained. Every public bathroom, every water fountain, I'm washing my hands. People probably think I have OCD, but I'm just trying to not catch something that could hurt my baby. It's exhausting being this vigilant all the time. Skin infections become more common during pregnancy due to hormonal changes affecting the skin. Homeless women already face higher risks of skin infections due to limited hygiene access, and pregnancy compounds this. I developed a weird rash at 6 months that wouldn't go away, Jennifer shared. Finally got it checked at a clinic, turned out to be a fungal infection. They gave me cream, cleared it up in a week, but I've been dealing with it for a month before I could get to a clinic, just hoping it wasn't something serious. Dental infections are particularly concerning during pregnancy because the bacteria from gum disease can enter the bloodstream and potentially cause premature labor. My gums bleed every time I brush my teeth, which isn't often enough because toothpaste runs out, one woman admitted. I know dental health is connected to pregnancy health, but I can't afford a dentist and can barely maintain basic oral hygiene. I just pray my teeth hold out until after I give birth. Yeast infections are extremely common during pregnancy due to hormonal changes, and they're uncomfortable but generally not dangerous. However, untreated yeast infections at the time of delivery can be passed to the baby. I've had a yeast infection for basically my entire pregnancy, Maria said, embarrassed. Can't afford the medication to treat it properly, and the free clinic creams only work temporarily before it comes back. It's miserable and I'm worrying about passing it to my baby during birth. Sexually transmitted infections pose serious risks to unborn babies and need to be screened and treated during pregnancy. Many homeless women have histories of sexual trauma or survival sex, putting them at higher risk. Getting tested for STIs during pregnancy is terrifying because you're refacing your past while trying to protect your future, one woman shared. But it's necessary. Untreated syphilis or gonorrhea can cause stillbirth, birth defects, or infant death. The prenatal clinic tests for everything, treats whatever they find. Food poisoning and foodborne illnesses are more dangerous during pregnancy. Listeria, found in contaminated food, can cause miscarriage or stillbirth. When you're eating from dumpsters or relying on donated food of questionable freshness, the risk is constant. I'm so paranoid about food safety now that I'm pregnant, Rachel explained. I smell everything multiple times, check for mold or spoilage obsessively, avoid anything that seems even slightly off. I vegan hungry rather than eat something questionable because the risk to my baby isn't worth it. But preventing these various infections requires more than knowledge and vigilance. It requires resources that most pregnant homeless women simply don't have, which brings us to the cruel reality of trying to access prenatal care without insurance, money, or stable housing. Because the healthcare system that should be protecting pregnant women is often the biggest obstacle they face. Prenatal care is essential for monitoring infections and overall pregnancy health. But accessing regular appointments is incredibly difficult for homeless women. You need transportation to appointments, which costs money. You need ID and insurance information, which many homeless women have lost or can't access. You need to show up at specific times, which is hard when you don't have a phone alarm or calendar system. The barriers are endless, Jennifer explained. I've missed appointments because I didn't know what day it was, because the bus cost money I needed for food, because I was dealing with some crisis that took priority over a routine checkup. Free prenatal clinics exist in many cities but have limitations. Long wait lists mean you might not get your first appointment until you're months into pregnancy. Limited hours mean working around their schedule, not yours. Overcrowding means rushed appointments where infections might be missed. The free prenatal clinic has been helpful, but I've waited up to 6 hours to be seen sometimes, one woman shared. When you're pregnant, homeless, and sitting in a waiting room for 6 hours, it's exhausting. But it's the only prenatal care I can access, so I deal with it. Prenatal vitamins are expensive, costing $15 to $25 per bottle, and most women can't afford them. Folic acid is critical for preventing birth defects, but it's just one of many nutrients pregnant women need. I take the free prenatal vitamins from the clinic when they have them, but they run out frequently, Maria said. When I don't have vitamins, I try to eat healthy, but healthy food costs more than junk food. I do my best, but know my baby probably isn't getting optimal nutrition. Pregnancy-specific medications, like those for nausea, blood pressure issues, or gestational diabetes, are often unaffordable even when prescribed. The clinic prescribed me medication for severe morning sickness, but the prescription cost $50, one woman explained. I couldn't afford it, so I just suffered through months of vomiting multiple times daily, barely able to keep food down. Lost weight during my first trimester instead of gaining it, which scared me, but what could I do? Testing for infections and monitoring pregnancy complications requires lab work that's expensive without insurance. Pregnant women should have urine tests at every prenatal visit to check for infections, plus blood work to screen for various conditions. When you have insurance, these tests are routine and covered. When you don't, each one is a financial burden. I've had minimal testing during my pregnancy, Rachel admitted. Just the absolute bare minimum the free clinic can provide. I have no idea if I have gestational diabetes or if my baby is developing properly beyond what they can tell from basic exams. Ultrasounds are another expense that many homeless pregnant women can't access. While not essential for every pregnancy, ultrasounds can detect problems early and help establish accurate due dates. I didn't get a single ultrasound during my pregnancy until I went into labor, one woman recalled. Had no idea exactly when my due date was, no idea if the baby was developing normally, no pictures of my baby to look at and connect with. Just hoped for the best and tried not to think about what could be going wrong that I couldn't see. The psychological impact of inadequate prenatal care creates constant anxiety that probably isn't good for the baby either. Every day I worrying about what might be wrong that I don't know about, what infections might be growing that I can't feel yet, whether my baby is okay, Jennifer said, visibly stressed. The not knowing is torture. Housed pregnant women can go to the doctor whenever they're concerned. I have to decide if my concern is emergency level serious or if I can wait until my next clinic appointment in 3 weeks. But beyond the formal healthcare system, pregnant homeless women have developed their own survival medicine specifically tailored to pregnancy. The knowledge shared between women becomes a lifeline when professional care is inaccessible. Because street pregnancy wisdom, passed between women who've survived it, can mean the difference between a healthy baby and a tragedy. Body monitoring becomes incredibly detailed. Women learn to track their baby's movements, noting patterns and recognizing when something seems wrong. My baby usually kicks most actively after I eat and in the evenings, Maria explained, demonstrating where she feels movement. If a whole day goes by without normal movement patterns, that's a warning sign something might be wrong. I've rushed to the ER twice thinking something was wrong. Turned out baby was just sleeping more than usual, but better safe than sorry. Temperature monitoring helps detect infections early, since fever is often the first sign. Some women manage to get thermometers from donation drives or buy cheap ones from dollar stores. I check my temperature at least once a day, more if I'm feeling off, Rachel said, showing me a battered digital thermometer. Anything over 100.4 degrees when pregnant means potential infection and immediate need for medical care. This little thermometer might have saved my baby's life already when it caught a kidney infection early. Vaginal discharge monitoring is another skill pregnant women develop. Normal pregnancy discharge is clear or white and doesn't smell bad. Abnormal discharge, yellow, green, gray, foul-smelling, or accompanied by itching, indicates infection. I never thought I'd be inspecting my underwear like a forensic scientist, but here we are, Jennifer joked darkly. Any change in discharge color, consistency, or smell sends me into panic mode and to the clinic if I can get there. Pain monitoring requires distinguishing between normal pregnancy discomfort and signs of infection or complications. Round ligament pain, Braxton Hicks contractions, general achiness, these are normal. Sharp pains, cramping with bleeding, pain with fever, these signal problems. Learning the difference without medical training is scary. I've gotten pretty good at knowing what's normal pregnancy pain versus danger pain, one woman explained. But there's always that doubt, that fear I'm wrong and ignoring something serious. Blood pressure monitoring would be ideal, but requires equipment most homeless women don't have. High blood pressure during pregnancy can indicate serious complications. Some women check their blood pressure at pharmacies that have free blood pressure machines. I go to the pharmacy once a week and use their blood pressure cuff, Maria shared. The pharmacist there is nice about it, knows I'm pregnant and homeless. If my numbers look bad, I know to get to a clinic immediately. Swelling monitoring helps detect preeclampsia, a dangerous pregnancy complication. Mild swelling of feet and ankles is normal, but sudden severe swelling of hands, face, or legs is a warning sign. I watch my hands and feet constantly, Rachel explained. Take off my rings when I can feel them getting tight. If my face looks puffy in bathroom mirrors, that's concerning. Preeclampsia can kill you and your baby fast, so catching swelling early matters. Nutrition management with limited resources becomes an art form. Pregnant women need extra calories, more protein, specific vitamins and minerals. On the streets, you eat what you can get when you can get it. I prioritize protein when I have choices, Jennifer said. Peanut butter, beans, any meat I can get. Try to avoid junk food even though it's often the most accessible option. My baby needs nutrients more than I need convenience. Hydration is even more critical during pregnancy than normal, but we've discussed how challenging water access is. Being dehydrated during pregnancy can trigger contractions, reduce amniotic fluid, and stress the baby. I drink every chance I get, Maria emphasized. Carry multiple water bottles, fill them whenever I find clean water. Probably pee every hour because of the pregnancy and the water intake, but keeping hydrated is non-negotiable. Rest and sleep are crucial for pregnant women, but incredibly difficult when homeless. Growing a human is exhausting, your body needs more sleep. But sleeping on the streets is uncomfortable, often unsafe, and rarely restful. I'm so tired all the time, one woman said, exhaustion evident on her face. Not just normal pregnancy tired, but running on empty, never getting real rest tired. I know it's not good for the baby, but I can't exactly check into a hotel for a good night's sleep. Stress management is important because chronic stress affects fetal development, but reducing stress when you're pregnant and homeless is nearly impossible. Everything is stressful every moment of every day, Rachel stated flatly. Where will I sleep tonight? Where will I give birth? How will I care for a newborn on the streets? Will my baby be taken away? Will we both survive this? The stress is constant and crushing, and I know it's hurting my baby, but I can't magically make my situation less stressful. Community support among pregnant, homeless women provides emotional sustenance and practical advice. Women who've been through homeless pregnancy before mentored those experiencing it for the first time. An older woman who had to babies while homeless taught me everything I know about street pregnancy survival, Jennifer shared. Told me which shelters were safest for pregnant women, how to access prenatal care, what symptoms to never ignore. She basically kept me and my baby alive through knowledge sharing. Now I try to do the same for other pregnant women I meet. Preparation for birth becomes an obsession in the final trimester because giving birth while homeless presents unique dangers. Where will you deliver? How will you get to a hospital? You go into labor suddenly. What will happen to your belongings while you're giving birth? These questions haunt pregnant homeless women constantly. I have a bag packed with everything I'll need for labor. And the baby's first days, Maria explained, showing me a worn backpack. Clean towels, baby clothes from donations, diapers, baby blankets. If I go into labor on the street, at least I'll have supplies. Though honestly, I pray every day I make it to a hospital. Emergency delivery knowledge is something some women acquire, learning basic information about what to do if they can't reach a hospital. I've read everything I can find about emergency childbirth, Rachel said. How to deliver the baby yourself if necessary, how to tie off the umbilical cord, what warning signs mean I'm in serious danger. Hope I never need this information, but if I go into labor at 3 a.m. under a bridge, at least I'll have some idea what to do. Hospital labor and delivery are free in most states under emergency Medicaid provisions, but many homeless women don't know this or fear the hospital will contact Child Protective Services. I'm terrified of giving birth in the hospital, one woman admitted, afraid they'll judge me, treat me badly because I'm homeless, maybe try to take my baby away. But I'm also terrified of giving birth anywhere else because so many things can go wrong. It's paralyzing fear no matter what choice I make. Postpartum infection risks are high, especially with inadequate prenatal care and poor living conditions. After birth, women are vulnerable to infections of the uterus, cesarean incisions if applicable, and breast tissue if breastfeeding. How am I supposed to recover from childbirth while living on the streets? Jennifer asked rhetorically. You're supposed to rest, stay clean, monitor for infection, attend follow-up appointments. None of that is possible when you're homeless. Women die from postpartum infections, and I might be one of them. The future after birth looms large with questions about how to care for a newborn without housing, whether Child Protective Services will intervene, whether survival is even possible. But pregnant homeless women can't afford to think too far ahead. They focus on today, this week, making it to the next trimester. I can't think about after the baby is born, Maria said, unconsciously cradling her belly. If I let myself think about trying to care for a newborn on the streets, I'll lose my mind. Right now, my only job is keeping this baby alive inside me until it's time for him to be born. Everything else I'll deal with when I have to. The determination these women show, continuing pregnancies under circumstances that would break most people, speaks to the power of maternal love and the instinct to protect your child at all costs. Every infection prevented, every prenatal appointment attended, every healthy choice made despite impossible circumstances is an act of fierce love. These babies are wanted, fought for, protected with everything their mothers have, which often isn't much besides determination, knowledge, and hope, but somehow many of them survive. The mothers and babies who make it through homeless pregnancy are proof that human resilience and maternal instinct can overcome even the most brutal circumstances. As Maria told me late in her pregnancy, one hand on her swollen belly, tears streaming down her face, "This baby is all I have left in the world. Everything else has been taken from me, my home, my job, my dignity, my future. But this baby is mine, and I will do anything, survive anything, endure anything to give him a chance at life. Every day he's still moving inside me, still growing, still alive despite everything working against us. That's a victory. I might lose in the end, infections might take us both, but I'm fighting with everything I have. Because he deserves a mother who fights, even when the fight seems impossible."